some extent, my question is motivated by a bit of a disappointment, not at the nature of what was said, because I think the fact that it was said as well as it was has brought about these questions, but a disappointment that we didn't direct our attention more directly to the issues of finance and governance, which each one of the speakers sort of flirted with for a while and then ran away from. Why I say that is because it's been my impression that at one level, the macro level, where the political debate is occurring, there seems to be maybe the generalization that one particular political party would like to see a unitary state with as little devolution of authority down the line as possible. And then there are obviously other parties that have variations on that theme, or radically different, if you listen to the TV, radically different solutions. But none of the speakers actually grappled with the finance issue and the governance issue, because the last speaker said that there are different interpretations of primary health care throughout the world, and that's probably why we've had varying degrees of success. I'd like to put this hypothesis. Is it not because there's a difference in emphasis between what the health sector understands as good governance and sound financial allocation, and what the government of the day understands by what good governance is and sound financial allocation? And it's the tension that exists there, and the tension that is unresolved, that makes it so difficult for us to have a primary healthcare system that actually works. And unless we sort out through the forum that has been hinted at here, unless we sort out that fundamental issue, we're not going to be able, either in the death throes of the present government or in the new life that the new government gives us, to be able to anticipate a really successful primary healthcare system. We need to grapple with those issues directly and immediately with some degree of expertise and urgency.
Thanks very much, Prof. You've said that focus so well. I don't know who here wants to respond. I wonder if you can ask David Sanders if he wants to comment.
It's nice to be given the hard one. That's the first one. I'm not sure I understand it correctly. Let me rephrase it in the way that I understood it and see whether it's right, and then I'll attempt an answer. In the terms I understood it, I understand you to be saying if the government doesn't get its development strategy right, overall socioeconomic development strategy right, then it doesn't really matter too much what's being said inside the health sector. So if the political, the economic, what you call the governance, the financial allocations and process are not correct, then primary health care will not be able to define itself in the brave way in which people have attempted to so do. Is that correct?
Yeah, just the practical examples. We heard the first, second, and third speaker say it's jolly good for us to have this consultation going all the way through, and for the very clear roles to be visible throughout the system, this devolution of authority throughout the health system. And then there's this implicit understanding that they will therefore finance will follow that decision as well. The reality we know is radically different from that. We know that we don't have that sort of situation now, and I don't know whether we're going to have it in the future. And I think that is the essential ingredient of being able to get a system off the ground.
I understand what you're saying. I'd actually like to take it a bit further. It does seem to me that if one looks at successful examples in developing countries, in South Africa, I noticed in the newspaper these days, it's called a developing country, probably rightly so. The successful advances in health have been achieved in very few countries. There's a Rockefeller Foundation publication called Good Health at Low Cost, which gives 5 examples of countries which have achieved good health at low cost. Most of them are countries where the political dispensation is one of very substantial democratization, from experiments in social democracy in certain developing countries like Costa Rica or Sri Lanka, or Kerala state in India, which had a communist government for a long time, right through to countries like China where social revolutions took place. Those are the examples that are given. But really what determined the advances in health was the political process, fundamentally. What happened, how the political process informed the development strategy, and within that, the approach to health. And I think one really has to ask those hard questions. Louis talked about reversing the process of underdevelopment. The process of underdevelopment that's occurring in this country and many other developing countries, or underdeveloping countries, if one wants to be more precise, is situated within an economic, both national and international economic framework. The question is, how does one turn that around? Because if you don't turn it around, there aren't finances to be allocated to the health sector. Because as we see internationally, the international finance bodies such as the IMF and the World Bank are imposing structural adjustment programs, which means cutting funding to the health sector. But we're still, I think, suggesting an economic direction, which is for quite a long time going to ensure that there are not funds available for general development. But that's the reality that we're in. So I think the very difficult question is, how does one ensure that this political process that people are talking about, democratization, does really empower those people who are disempowered to demand something different, something quite different, something that I'm afraid is not solely within the health sector. It really demands a completely different development strategy on the market. I think that's what we have to be talking about. We have to be talking about job creation, the situation of economic decline. We have to talk about how the health sector can facilitate that. The concrete example, since I may appear to be very abstract, is we've talked about this. The National Nutrition and Social Development Program, so-called food aid program, which is mostly about food handouts at the moment. Why isn't it the case that those monies and more, and we know that the drought relief program for white commercial farmers has been on the order of, I think, 3 billion rand, whereas 440 million are given to the food aid program. Why isn't some of that money mobilized to turn that program into a job creation program based on public works, for example, for which people will get paid to be able to buy the food that presently is given to them through certain agencies, such as Operation Hunger, which give food handouts. It's that kind of thinking, I think, that we have to be talking about.